फाइनल ईयर है और हुआ है
फाइनल ईयर में
फाइनल ईयर और एचओ है
Assalamualaikum everyone. On behalf of the research team of the Department of Operative Industry, I would like to welcome you all and thank you all for being here and leaving your patients, if there are any, and the bake sale and coming here for this session. At the outset, let me just explain why we are here. So, the research team of Operative Industry planned a mixed method study, that is a quantitative plus qualitative research, which was presented here in November, right? So we've completed the quantitative phase where we distributed questionnaires that you all filled out and told us about your musculoskeletal discomfort, right? Now then we had the qualitative phase where we had focus group discussions with faculty, residents and house officers and students. Now we come towards our intervention phase, and that is this yoga/physical therapy session to mitigate the challenge of work-related musculoskeletal discomfort. For those who still do not know what that is, so work-related musculoskeletal discomfort is basically pain in your muscles or your skeletal system thanks to the profession. So the profession that we have, dentistry, is a tiring profession. It's something that stresses out our muscles. We have a number of patients that we do every day, prolonged procedure times, and we have compromised postures as well, which causes spondylosis, cervical pain, compressed C4, C5 vertebra, numbness in the hands, X, Y, and Z, right? So there are a number of researches published worldwide which addresses the prevalence or the frequency of work-related musculoskeletal discomfort, and the prevalence is 65 to 95%. So basically, someone carried out research on their population and found that 95%, that means every person, almost every person, had some sort of muscular or skeletal pain, being a dentist, right? In our population at DIDC, let me announce that our frequency was 79.62%. And this is when I take third year into account. Third year was just started their clinical practice or just started visiting periodontology. If I take that data out, if I omit that data and I count final year, and by final year we mean the new final year, okay, जिन्होंने इतने patients नहीं किए अभी तक. So final year, house officers, residents and faculty, the frequency rises to 86%. यानी हम में से अगर 10 लोग देखें तो उनमें से 8.5 या 9 लोगों को, almost 9 out of 10 have some sort of musculoskeletal discomfort, which is alarming. Okay, हम by the word हम majority house officers हैं. अगर at the age of 25, 26 ये हाल है, so 10 years down, 5 years down, what are we looking at? Why do I make this point very clear to you and I'm elaborating on it? Is क्योंकि दुनिया ये research कर चुकी. It is something that is old. We know that WMSD exists, but no one, especially in Pakistan, has done anything to mitigate the challenge, to decrease the challenge, to alleviate the challenge. ये पता करना कि हाँ जी ये chances बहुत ज़्यादा हैं. Very good. So what can be done? So there are 3 solutions. Number 1, ergonomics, proper posture, proper seating, proper use of the equipment and instrumentation and armamentarium. Number 2, your nutrition. What are we eating? And number 3, physical therapy and yoga, so that you can work your muscles, strengthen your muscles, tone your muscles in a way that they can bear those stresses, or they can release or relieve those stresses that are generated during procedures. So this is the first mixed method study in Pakistan and globally. This is the first research in Pakistan looking for an intervention or a solution to workplace-based musculoskeletal discomfort. There are other researches, isolated intervention researches internationally, but none have collectively in one research under one umbrella looked to address the quantitative avenue, the qualitative avenue, and the intervention. So this was about the research. Today's session is a physical therapy / yoga session aimed at providing you with the baseline knowledge and exercises that may be performed between patients in a 5-minute window that does not or would not be needing yoga mats, extensive spaces, some privacy issues, वो चीज़ जो आप चेयर साइड पे अपने क्लिनिक्स में परफॉर्म कर सकते हैं बगैर किसी बहाने के। मेरे पास टाइम नहीं है, मेरे पास जगह नहीं है, योगा मैट कौन बिछाएगा, जिम कौन जाएगा, वो वाले बहाने नहीं हैं। It is plain and simple. I want to take care of myself and my muscles for a prolonged, efficient period. Between patients 5 मिनट सबको मिल जाता है। मैं अगर 10 पेशेंट्स भी कर रहा हूँ तो मुझे दिन में 50 मिनट मिल जाएंगे, नहीं मिलेंगे तो between 2 patients मिल जाएंगे। It's something that we need to do. So for this session, we are very honored to have Dr. Noorul Ain Javed, who is an assistant professor, Department of Operative Dentistry and Endodontics at Dr. Ishaqul Ibad Khan Institute of Oral Health Sciences. Madam is one of our own, and why do I say so? Not only that she has been my supervisor, and I owe a lot to her in terms of operative dentistry and endodontics. But because she is a dentist, because she is a specialist endodontist, because she is from our field, and now a certified yoga facilitator, she brings in a wonderful fusion of both. जो हमें ये सिखा सकती है, जिनको पता है कि हमें कहाँ कहाँ दर्द होता है, जिनको पता है कि हम कौन कौन से प्रोसीजर्स परफॉर्म करते हैं, कितनी देर के लिए परफॉर्म करते हैं, हमारे एर्गोनॉमिक्स में क्या प्रॉब्लम है, और हमें प्रॉपरली कौन सी एक्सरसाइजेस चाहिए। अनदर योगा फैसिलिटेटर वो अपना कहीं से एंगल लेकर आ जाते हैं, नॉट नोइंग कि हम डेंटिस्ट क्या फेस करते हैं। सो शी ब्रिंग्स इन द परफेक्ट कॉम्बिनेशन and she will be leading the session. Other than that, we have our physical therapist, our guest from Aga Khan University, Dr. Amir Ali, who is a doctor in physical therapy and a master's in research. So, ये आपकी objective findings देख रहे हैं. 2 forms have been circulated. One is a consent form, which clearly states कि yoga session है, yoga में आप participate कर रहे हैं, अपने risk पे participate कर रहे हैं. That yes, pictures are going to be taken, and yes, the data is going to be used for research purposes. Okay? Do go through the form and sign the consent form. The other form that is being circulated is the modified Nordic questionnaire, which is a validated tool for self-assessment, where you will mention whether you have had pain or no pain over the last 1 month or 7 days, or have you taken any medicines or not. Right? And while you're performing your yoga, our physical therapist is going to be assessing you for the limitations in your movement and seeing कि ये limitation मिली, नहीं मिली, कितना में मिली. Clear? Now can I hand over the mic to Dr. Noorul Ain Javed? Madam, please.
Bismillahirrahmanirrahim. Assalamu alaikum sabko. I request organizers to turn off lights from the front part of the hall. And participants, turn your mobile phones on silent. उसको वाइब्रेटर पे भी मत रखिएगा वरना आप ड्यूरिंग द मेडिटेशन डिस्टर्ब हो जाएंगे. साइलेंट कर दीजिए. Let's check that everybody is sitting properly, utilizing the similar slot, and we have 1 slot available. Bismillahirrahmanirrahim. So there is a disclaimer before I begin. If any muscle is weak or already having spasm or a trigger, you can feel that spot tender during or after the session. But this I can guarantee you, today's class will not cause any injury to you. And during the meditation session, there will be 3 sessions today. first session is the exercise using a musical video. So we'll perform head to toe scan and head to toe exercises, releasing the fascia and dynamic exercises. And after that, that will take 20 to 25 minutes. Okay, and we'll do on the chair. Followed by a meditation, 10 to 11 minutes meditation, and it's a solar plexus meditation using the theme of sunrise and the ocean. That will be our second video, 10 to 11 minutes. Followed by my 2 minutes, 1 to 2 minutes performance that I do between patients and after namaz, daily basis. So in the end, I'll perform head to toe, full body stretch using world's greatest stretch flow of 2 minutes with a musical video, so that you can see how I heal myself and what I do between my patients. So are you ready? Shall we start? Shall we begin? Okay. So turn on the music.
So before we do, all consent forms signed? और अगर नहीं हुए तो फिलहाल फॉर्म्स को साइड पे रख दें so that you can follow the session. ये हम बाद में भी फिर करा सकते हैं.
Remove your shoes for the better experience. I'm keeping my shoes below my chair. So you are sitting on a chair with the spine straight, back supported, body relaxed, knees widely open as much as the width of your hip. And there is a space between my knees. My feet are touching floor. I can feel my support in my chair and my connection with the Mother Earth. So as soon as you achieve, you are ready to start. Keep your palms
All set?
on the top part of the thighs, both hands. So I'm using my one hand, you use your both hands. And rub your palms on the top part of the thigh to connect with your body and your soul. With all your focus with the music and the video at the back. And rotate your shoulders backward. Let all the tension go away from your neck on your shoulder. Bring your elbows close to your body. Palms touching your top part of the thigh. Soften your gaze or close your eyes and listen to your breath. Inhale from nose and exhale from mouth. Just normal breath. How you breathe, what you're feeling. Where are you sitting? How are you sitting? And now with this, we'll start with a hand orientation. Raise your right arm up and inhale. Exhale, bring right arm down. And feel sensations coming. रोंगटे खड़े होते हैं. Left hand, inhale. Raise your arms up. Left hand, exhale. Cleanse your aura. One more time. Inhale, right hand up, and in your imagination you are making a 7 colors rainbow. And exhale, cleanse your aura. Feel your energy. Left hand, inhale, left hand up. In your imagination you are making 7 colors rainbow coming out of your fingertips. Inhale, exhale. So when we open our both arms, inhale, open chest out. Exhale, close your arms, engage your core. So when we inhale, we open. And when we close, we exhale. Now reset your stress breath. So how you breathe, you inhale from nose 4 seconds. Exhale from mouth 8 seconds. One more time, inhale. Exhale. So we give ups can be tender because you can store your trauma, your negative energy here. So keep breathing. Come back center. Now use your fist and place it on the right side of the TMJ and vibrate. This can be tender. Inhale, push skin upward in the temporal area. Make a question mark around your ear. Apply ample amount of pressure using your knuckles and release your sternocleidomastoid muscle downward and rotations on the clavicle area. You are draining the lymphatic system. This will help you reduce the swelling of your face. Left side, left TMJ, vibrate. Keep breathing. Push skin upward using your knuckles around your ears. Press downward on your sternocleido, clavicle rotations. 2, 3. Right thumb, right mastoid process where the sternocleido connects. Press. Breathe. This can trigger headache towards the right temporal area. Massage and release. Left side, press, massage and release. Make a fist with the right hand, apply the knuckles, ample amount of pressure, right hand upward, push skin upward. This can be tender. Breathe, right side, push upward. Breathe, left hand, knuckles, push upward. Breathe. Both hands massage your temporalis muscle. There can be a trigger in the anterior, middle or posterior. The other side, the right side, massage. Check how you're feeling in your temporalis muscle. Where the ear connects with the temporalis with the finger, apply pressure here. This can be very tender. Both fingers, both sides. And this can again trigger a headache towards the temporal area. Keep pressing hard and slowly you will notice the pain is coming down. With your thumb below your chin, push your thumb to the side to release the fascia from the chin area. Open your arms, open your chest. Inhale both hands. Raise your arms up. Exhale. One more time. Inhale. Exhale. And there is a 7-color rainbow in your imagination. Now we'll start with the neck. Small circles. If you anybody with the cervical, small circles. Neck rotations. Anti-clockwise. Just check how you're feeling in your neck. Find your comfort zone. Tuck your chin on the chest. Keep breathing. Keep tucking your chin there. And when you are doing this, breathe and connect with your body and soul. You're feeling the opening up of the muscles at the neck, at the back, and the top part of your back. Keep breathing. Come back center. Support your neck using your both hands and very slowly you are taking your neck at the back. You can feel dizzy. If there is a trigger in the cervical area, keep your neck supported as much as you're comfortable. Take your neck at the back. Keep breathing. Look up, chin up to the ceiling. And feel the opening up of the front part of your neck muscle, that is platysma. Keep your neck supported. Keep breathing. Come back center. Turn your neck to the right side. Chin on the right shoulder. Keep breathing. And try to bring your neck down. And try to look towards your right armpit area. Now the right sternocleido is opening up. Keep breathing. Come back center. Chin to the left shoulder. Your left side of the neck, right side of the neck is opening up. And again, tilt and try to observe your left armpit and how the neck muscles are feeling. Come back center. Use your right hand, left ear, and bring your right ear towards your right shoulder. Keep breathing. Connect with your body, how you're feeling. Come back center. Be very gentle. Left hand, right ear. Very gently stretch your neck. Check your range of motion, comfort zone. And you can feel burning. If you feel burning and a lot of sensation, then stay there towards your comfort zone. Now we'll start manipulating our shoulders. For shoulders, both hands. Inhale, exhale. Anti-clockwise. Interlace your fingers, hands behind the back. When we open chest, we inhale. Exhale. And you'll feel it in your complete spinal cord again. Right hand up. Support your ribcage with the left hand. And we'll open the thoracic area at the right side. Support, hug. Exhale. Look up, chin up. Open your chest. Come back center, left side. Left arm up. Open, support. Inhale, exhale. Look up, chin up. Come back center. Now extend your arm on the side, both arms, palm facing to the ceiling. Your neck is going towards your right shoulder and finger are coming towards the. So you're gliding your hand and neck together. Again, center. Bend at the wrist, both coming together, neck. We are performing the right side, not the left side. Extend your arm, bend, and you can feel electric shock-like sensations. This means there is a trigger at the nerve area. One more time. This is the median nerve. Now the radial nerve is opposite, palm facing down, bend at the wrist, and you're actually approaching your shoulder with the hand. Yes, one more time. The other hand. Extend your arm and you can feel electric shock-like sensations. Electric shock-like sensations. One more time. And now we are approaching towards the star of the show, that is the ulnar. So make this. You are going to move your fingertips towards your face. My palm facing upward. And then fingers touching my cheeks, and I'm trying to look my friend Dr. Masood through this. And now I'm pushing my elbow out. A lot of sensations. Relax. Other hand. Upward. Fingers touching my cheek. Yes. Try to look your favorite person through this. Exhale. Relax. So now we'll perform lower body exercise. So figure 4 guys, figure 4. Now you are going to utilize the front part of the chair. My left leg is at 90 degree. My knee is over my ankle. And I'm making actually number 4 with my right leg. My ankle is not on my thigh, it's in the air. It's not supported with the thigh. Now right palm, right knee, push down. Breathe. This is is a thigh hip joint opener. This can be tender. You will feel it here, thigh hip joint opener. Push. Inhale. Interlace your fingers around the knee. Exhale and try to look your friend at the back. And you can, if you feel it here, this means the muscle is weak and there can be a trigger. And if you're not drinking enough water, ये spasm में चला जाएगा. Again, right ankle, right thigh पर है. Ankle rotations करेंगे clockwise. Let's check what is the range of motion of the right ankle, anti-clockwise. Now, very special exercise. This is also the star of the show. Both hands in the thigh hip joint area. Lift yourself up. Inhale. Exhale. A lot of sensations in the right hamstring. 45 degree. 40. Yes, excellent. Spine and hip 45. A lot of sensation in the right leg. And if you're feeling it, raise your hand up. Exhale. Come back center. Now it's left leg, guys. Left ankle, right thigh, left palm, left knee. Push, inhale, rotate your shoulder backward. Do not engage your shoulder. Push down, keep breathing. You're actually going to drop your weight on the leg. Need to open up the thigh joint. And this is the psoas muscle you are actually manipulating. And the piriformis, a lot of sensations. Interlace your finger, inhale, exhale again. Spinal twist, trying to find my friend at the back. Come back center. And hold at the thigh hip joint, lift yourself up. Exhale 45 degree to your hip. And if you feel a lot of sensation in the left side of the thigh, this can be your piriformis. You can feel it in the inner side. Keep breathing. A lot of sensation in my foot area, my hamstring area, calf area. Keep breathing. Ankle rotations. Come back center. Clockwise and anti-clockwise. Now scapular retraction. I'm sitting utilizing the front part of my chair. My spine is straight, body relaxed. Rotate your shoulders backward. Inhale. Exhale. Let all the tension, stress go from your shoulders and arms. Hold your hands in front of your chest. Inhale. Exhale. Inhale. There's a modification of exercise. I'm keeping the back side of my hand behind my back. Both hands. Inhale, exhale. Exhale. Extend your both arms up. Finger extension. Curl your fingers. Finger extension. Long fist, flat fist, finger extension, closed fist, finger extension, claw fist, finger extension, long fist, finger extension, flat fist, finger extension, close fist. Shake your arms. And now we will be moving towards the meditation session. Please turn off all the lights from the hall and help me remove the chair from here. It's 10 to 11 minutes meditation. It's normal to feel numb, dizzy. I need help from Dr. Masood sir to turn the musical video of meditation on. I'll be moving towards the back side of the stage. So this is specially designed, the inner strength and willpower. Bismillahirrahmanirrahim. Welcome to Solar Plexus Meditation for self-awareness, emotional release and inner strength. I'm your trainer, Dr. Noor from this Yoga Fusion. Gently bring your attention towards the horizon, where the sea meets the sky, to the very first light of the sunrise. Emerging from the edge of the ocean. As the first light touches the edge of the horizon, don't just watch the sunrise. Let it awaken emotions within you. Let your breath move with the sea. The ocean does not resist its rhythm, and neither should you. Place your both palms on your belly, your fingers around your umbilical area, and gently bring your awareness to this. Gently press fingers of both hands. Now inhale from nose, fill your body, belly like a balloon. Inhale with the rising wave. Inhale all the peace and exhale from the mouth. Exhale all the stress out as if it's melting back into the sea. You're physically present in your imagination at the beach. Just observe your breathing. Now breathe as per your pace, focusing on your natural breath. So inhale from nose and exhale from mouth. Focus on your emotions, confidence and inner strength in your umbilical area. And you can see sun rising. This area is connected with your digestive system and play vital role in your body stress response. The sun is getting brighter. Just observe what is there in your umbilical area. You don't have to change anything. Just observe your emotions. Sun is at horizon and getting bigger and brighter. Focus on bright yellow light at your navel area, similar to the sunrise. Connect with your body. When you inhale, light gets bigger and you feel peace in your body. When you exhale, ocean waves leaves you calm and strong. Music begins. Now you can close your eyes gently, but I suggest for the best experience, keep your eyes gently open and lower your gaze. Listen to the music, gently pressing at your umbilicus. You are imagining bright yellow sun at your umbilical area. It gets bigger when you inhale, and when you exhale, your negative energy goes out. जिससे जब हम मेडिटेशन परफॉर्म करते हैं तो कुछ ऐसे जज्बात होते हैं जिनको हमने एक्नॉलेज नहीं किया होता और वो सरफेस पे आना शुरू होते हैं, क्योंकि अब आपकी ब्रीदिंग स्लो होगी, आपका ब्लड नीचे जाएगा, बीपी नीचे जाएगा, आप अपनी इमेजिनेशन में बीच पे मौजूद हैं और सनराइज देख रहे हैं, और जब पानी की लहर आपके पैरों को छूती है तो आप इनहेल करते हैं, और जब वो छू के वापस जाती है तो आप एक्सहेल करते हैं। आपका दिमाग सूरज और इस इमेजिनेशन को देखने में मसरूफ है और आप अपने कानों से म्यूजिक, लहरों की आवाज़ के साथ अपनी ब्रीदिंग को सिंक्रोनाइज कर रहे हैं। तमाम तवज्जो अपने जज्बात तरफ कि आप इमोशनली क्या महसूस कर रहे हैं। क्या ये खुशी है? क्या ये गम है? क्या किसी ने अपने किसी प्यारे को खोया है, उसका एहसास है? क्या ये दुख है, कोई डिसअपॉइंटमेंट है, या ये डर है? ये जो कुछ भी है, इसको एक बार एक्नॉलेज कर लें ताकि इसको पता चल जाए कि आपने इसको देख लिया है और आप अवेयर हैं, ताकि अगली बार जब ये आपके सामने आए तो आप पहले से ज़्यादा मजबूत हो। अगर आप इस वक्त अपने पास्ट में हैं और डिप्रेशन फील कर रहे हैं तो अपने एक्सहेल के साथ पानी की लहरों को अपने पैरों को छू कर वापस जाता हुआ महसूस करें। आपकी बॉडी में डिफरेंट सेंसेशंस आएंगी। ब्रीदिंग से मदद लें और आप बहुत मजबूती से खड़े हैं। अगेन इनहेल, जो भी ये इमोशन है इसको महसूस करें और एक्सहेल के साथ पानी की लहरों को अपने आप को छू के स्ट्रेस को ले जाता हुआ देखें। मदर अर्थ आपकी तमाम नेगेटिव एनर्जी ड्रेन कर रही है। अगेन इनहेल एंड एक्सहेल। Now very gently raise your gaze, open your eyes and focus in your imagination. You are at peace, you are calm, and now start rubbing your palms together so that your right hemisphere connects with the left one. And if you are feeling that you are in the future, you will be feeling anxiety. And if you are in your past, you will be feeling depression. You just have to acknowledge whatever it is, and at the very moment, if a tear needs to fall on your cheek, let it release out with your exhale. Start rubbing your palms and keep your palm on your eyes. Bismillahirrahmanirrahim. فَكَشَفْنَا عَنْكَ غَطَاءَكَ فَبَصَرُكَ الْيَوْمَ حَدِيدٌ. Your palms on your cheeks, look up, chin up, and feel your strength and balance in your life. Both palms on your heart. And bow, little bit, chin down. Breathe. Come back center, hug yourself with both hands. इससे एफर्मेशंस बहुत ही स्ट्रॉन्ग होती हैं, तो जो मैं दोहराऊँ मेरे साथ दोहराएं, इसका पॉजिटिव इम्पैक्ट आपको फील होगा। आई एम हैप्पी इन माई लाइफ। आई एम हेल्दी इन माई बॉडी। पीपल अराउंड मी लव्स मी। I love my family. Your both palms on your throat. Allah bless me with a healthy thyroid. Your both palms on your brain area. Allah bless me with a sharp memory. And then rub your hands on your body as if you are releasing all the stress out. Now you're going to repeat after me. I am strong. I am confident. I am unbreakable. And you're going to, with me, both hands, make your fist. I'm feeling wow. One more time. One more time. I'm feeling wow. And round of applause for yourself. Today's class was not good. Because very बहादुरी से आपने अपने इमोशंस का सामना किया है। बड़ी हिम्मत चाहिए होती है ग्रुप में आके अपने इमोशंस को फेस करने के लिए। और अभी आप अगर नम फील करें, ऐसा होता है थोड़ा सा पॉज हो जाते हैं आप ना, स्लो हो जाते हैं, ये चंद मिनटों के लिए रहेगा। अपनी हाथ की उंगलियों को रब करिएगा। मैं एक परफॉर्मेंस आपके सामने कर रही हूँ 1 से 2 मिनट की, उसको ऑब्जर्व करें, तब तक अपनी चेयर पर रहें। दे आर गोइंग टू टर्न ऑन द Jermaine Gordon, Better With Me. This is my performance because how I heal daily basis. 1 से 2 मिनट लगते हैं and that's how I heal on daily basis. Just observe me. If you like it, let me know.
Are we all back? Are you feeling relaxed? For me, it was a wonderful session. The second for today.